When most people hear the word hospice, they think of giving up. They think hope is over. The fight is finished. The story is ending. But what if everything you've been told about pediatric hospice is wrong? And what if waiting too long to learn about it causes families even more suffering? Today, we're exposing one of the most misunderstood areas in healthcare. Let's address the elephant in the room. Nobody wants to talk about pediatric hospice. Nobody, not parents, not relatives, not friends, not even some healthcare professionals. Because the topic is uncomfortable, painful, terrifying. But here is a difficult truth. Avoiding a conversation doesn't make reality disappear. It only makes people less prepared when reality arrives. Many people assume hospice means doctors have stopped caring. Wrong. Many believe hospice means treatment automatically ends. Wrong again. Others think hospice is only about death. That is not the whole story either. Pediatric hospice exists because children and families deserve comfort, support, dignity, and quality of life during some of the most difficult moments imaginable. And understanding that changes everything. Meet Emma. She is 8 years old. Bright smile, loves drawing. Loves music. Loves making everyone laugh. Emma has a serious life-limiting illness. For years her family focused entirely on treatments, appointments, tests, hospital stays, second opinions, third opinions. Constant uncertainty. Every day became a battle, and eventually something unexpected happened. The family became so focused on fighting the illness that they forgot to ask another question. How do we make today better? Not next year. Not someday. Today. Emma's parents were exhausted. Emma was exhausted. Her siblings were struggling. Everyone was carrying emotional weight nobody talked about. Then a healthcare professional introduced the concept of pediatric hospice. The family resisted immediately. They thought it meant surrender. They thought it meant losing hope. But as they learned more, they discovered something surprising. Hospice wasn't taking support away. It was adding support. It wasn't replacing love. It was strengthening it. It wasn't ending care. It was expanding care, and that realization changed how Emma's family experienced the time they had together. Here is the problem. Most families don't understand pediatric hospice until they're forced to. And by then, they're already overwhelmed, emotionally exhausted, mentally drained, physically exhausted. The healthcare system can be incredibly complex. Families are often focused on treatments, appointments, medications, insurance issues, transportation, work responsibilities, and caregiving demands. Who can blame them? But because hospice is misunderstood, many families delay learning about it. Some avoid discussing it entirely. Others assume it is only relevant during the final days of life. That misunderstanding can prevent families from accessing valuable support earlier. Support for pain management. Support for symptom relief, support for emotional well-being, support for siblings, support for caregivers, support for the entire family. Here is the reality. The biggest barrier is often not availability. It is perception. Why is pediatric hospice so misunderstood? Because our culture often treats serious illness conversations like forbidden topics. People avoid them. Change the subject. Look away, pretend difficult realities don't exist. And when information is missing, assumptions fill the gap. Movies create myths, television creates myths. Social media creates myths. Fear creates myths. People hear the word hospice and imagine hopelessness. But healthcare professionals often describe something different. A multidisciplinary team focused on comfort, quality of life, support, and family-centered care. That is a very different picture. And here is another reason. Most people never need to learn about pediatric hospice until a crisis occurs. So education comes late. Sometimes very late. And late information is harder to process during emotional stress. Quick question: if your family faced a life-changing challenge tomorrow, would you rather learn about available support before the crisis? Or during it? The answer is obvious. Yet that is exactly what happens every day. Families are introduced to resources they could have benefited from much earlier. Not because anyone intended harm, because misconceptions delayed the conversation. So what does pediatric hospice actually provide? Let's clear up the confusion. At its core, pediatric hospice focuses on maximizing quality of life. That means helping manage symptoms, helping reduce discomfort, helping support emotional well-being, helping families navigate overwhelming situations. Care teams may include physicians, nurses, social workers, counselors, spiritual care providers, child life specialists, and other professionals, depending on needs. Notice something important. This isn't just medical care, it is human care. The child matters. The parents matter, the siblings matter, everyone matters. Hospice teams often help families create meaningful experiences, special moments, special memories, special opportunities for connection. Because quality of life isn't measured only in days, it is measured in moments. And sometimes those moments become priceless. Another important truth, support isn't only for the patient. Caregivers frequently experience stress, burnout, anxiety, sadness, and exhaustion. Hospice services often recognize that caring for the family helps care for the child, and that perspective changes everything. Families often report feeling less isolated, less overwhelmed, more informed, more supported, not because circumstances become easy, because they no longer face those circumstances alone. But here is the part almost nobody talks about. One of the biggest regrets some families express afterward has nothing to do with treatment decisions. It is something much simpler and much more human. The regret: waiting too long to ask for help. Not because they didn't love their child. Quite the opposite. Because they loved them so much. They wanted to stay strong, stay positive, keep pushing forward. And those instincts are understandable, but here is the reality. Strength doesn't mean carrying every burden by yourself. Strength sometimes means accepting support, accepting guidance, accepting help. Families often discover they don't need to choose between hope and support. Those things can coexist. Hope can mean hoping for comfort, hoping for meaningful experiences, hoping for family connection, hoping for peace, hoping for laughter, hoping for a good day. The definition of hope evolves. And that is something many people don't realize until they experience it personally. Let's reframe the entire conversation. Pediatric hospice isn't a story about giving up. It is a story about showing up. Showing up for a child, showing up for a family, showing up for moments that matter. Here is the truth. Medicine isn't only about extending life. It is also about improving life. And sometimes the most compassionate healthcare focuses on comfort, dignity, connection, and support. That doesn't make hope smaller. It makes hope different. Families facing unimaginable circumstances often discover extraordinary resilience, extraordinary courage, extraordinary love. And hospice care aims to support those qualities rather than replace them. Because every family deserves care, every child deserves comfort, and every moment deserves meaning. If this video helped you better understand pediatric hospice, subscribe for more evidence-based pediatric healthcare content. Our goal is to explain complex medical topics with honesty, compassion, and clarity. Leave a comment below. What healthcare topic would you like us to cover next? Your suggestions help shape future videos. And if you believe more people should understand pediatric hospice, consider sharing this video. Medical disclaimer: this content is intended for educational purposes only, and should not be considered medical advice, diagnosis, or treatment. Always consult qualified healthcare professionals regarding specific medical concerns and healthcare decisions. Thank you for watching. And remember, sometimes the most important healthcare conversations are the ones people are most afraid to have. Understanding them doesn't take away hope. It helps people find it in new places.